Sorry about that. And so Beck, I missed getting your introduction, but everybody will be okay with that. But Jason, would you go ahead just again, and that way we'll have it all on here for
Absolutely, yeah. My name is Jason Rowe. I'm with Mason Transit, and I'm the new operations manager.
Fantastic, thank you. Working down, I see Beck, and so Beck, I'm going to pass you over. Or no, go ahead and introduce yourself, please, for the record. Yeah.
I will introduce myself. I'm Beck Ashby. I chair the Peninsula RPTO, and I represent the city of Port Orchard on the RPTO as a non-elected official.
Thank you. Patty Perry, please.
Hi, I'm Patty Perry. I have the company called the Patty Wagon here in Mason County. I am a medical transportation service. Providing service for Medicaid and Medicare clients.
Terrific, thank you. Jamie, Jefferson Transit.
Hey there, I'm Jamie Brooke, and I am Jefferson Transit's Grants and Procurement Coordinator.
Linda Marchette.
Hi, I'm Linda Marchette, and I am the Transportation Manager for the new clinic that is about to open in Squim. We will be in NEMT providing transportation for the SUD clinic clients.
Fantastic. Ed.
Yeah, I'm Ed Coviello, and I'm here as PRTPO staff. I also work at Kitsap Transit as a long-range planner.
Jeff Vinecourt.
Hello, I'm Jeff Vinecourt, Kitsap Transit Access to the paratransit, and we also do dial rides.
Perfect, thank you. Perry, and I'm changing your name right now, Perry, so we'll get it right on the system.
Okay, hi, I'm Perry Carrington. I've been transporting medical transports for like 25 years here of the Skokomish tribe in Mason County.
Thank you for making the time to join us today. Nicole.
I can only be here for like a half hour or so then.
Okay.
So,
I knew you were busy, so we'll follow up anything we missed with you, Perry. We'll circle back with you. Thanks. Nicole.
Hi, my name is Nicole Gauthier. I'm currently wearing two hats at Transit. Right now, I'm the interim general manager, otherwise the fixed route operations manager.
Miranda.
Good morning. I'm Miranda Nash. I'm the mobility operations manager for Jefferson Transit and the interim financial manager.
Great. Dee Williams.
Hi, I'm Dee Williams. I'm the band pull coordinator for Kitsap Transit, but I run a band program where I issue vans to social service agencies so that they can transport their clients.
That's cool. Sounds like an innovative program we'll want to find out more about. Dina.
Hi, I'm Dina Geisler from OLICAP, which covers Clallam and Jefferson counties. I'm the Economic Empowerment Director, and along with our other employment and training programs, we have the West End Job Lift, 3 work vans that operate in our area.
Thank you. Wendy Clark-Getson.
Hi, I'm working also for Jamestown Tribe. I work for the tribal government, and we subcontract with Clement Transit for fixed route service. And I'm also involved with our commuter program, as well as trying to do electric vehicles.
Fantastic. Nancy.
Thank you. Hi, I'm Nancy Budd Garvin, and I'm a board member of ECHO of Fort Townsend. ECHO stands for Ecumenical Christian Helping Hands Organization. And this year we're celebrating 25 years of providing transportation to medical appointments, as well as errands and important appointments for those who cannot access either public transportation or drive themselves.
Susan, please.
Hi, can you hear me?
We can, thank you.
The one day I have audio and I have laryngitis. Sorry about that. I know, it's one thing or another. I am the, excuse me, the Tribal Transportation Manager for the Lower Elwha Clement tribe. That pretty much sums it up for me with my voice. Sorry about that.
Well, and as I
Hi,
understand
everyone.
it, Susan, you were really running the whole sort of transportation show there with Chris. So you've got a lot on your plate right now. Standing
Yeah,
up that
yeah.
new transit program.
Yes.
Well, thanks for making the time to join us today. Michelle.
Hello, I'm Michelle J. I am the Customer Service Manager for Kitsap Transit. And I unfortunately have another meeting smack dab in the middle of this, so I'll only be on for a little bit and then I'll try to join at the tail end if it's still happening.
Great, thank you for doing that. Elizabeth Safston.
Hello, I am the Community Liaison for the Peninsula region from the WSDOT Public Transportation Division. I'm kind of the point person for anyone who's interested in grants through our division for Kitsap, Clallam, Jefferson, Mason, and Thurston County. And I specifically oversee operating, transportation demand management, and planning grants. And so that includes the CPT HSTP grant.
Thank you. Elizabeth Buckingham, please.
Good morning. I'm the Acting Health Director for Macaw Tribe. I'm here because I got invited, and we do have paratransit. We do medical transports for our patients to area specialists. I know the tribe has a transit program, and I don't see them on here for that, but I'm not representing their transit program. I'm just here as the paratransit. Thank you.
Fair enough. Thank you for doing that. Tracy Parker.
Hi, this is Tracy Parker. I'm not going to show my face. I'm not feeling very well myself, and I'm a planner at the Squaxin tribe, and I was typically Tammy and Monica would attend this meeting, but I'm just here to listen in. So I do a lot of the grants, fundraising and stuff for transportation and other programs, but I'm here to listen in. So.
Well, thank you for doing that. Yes. And I did hear that Monica was not able to be here today, but we'll follow back up with
Let's
her.
hope she didn't catch my bug.
Oh, no. I think she has a schedule conflict. So
all right. Good to hear.
Okay. Amy.
Hello, I'm Amy Asher. I'm the manager at Mason Transit, and I decided at last minute to join this meeting so that I could get to know everybody on this call. I'm fairly new to the area, and I'm still getting to know all of the transportation providers. And Jason Rowe is here, and he's the one that will be able to speak intelligently on all of the services that we have.
Thank you. And Dina, last but certainly not least.
I think I went on already. I'm Dina from OLECAP. My internet is going in and out, so
okay.
They're working outside my place, so I just popped back in again.
Okay, well that's probably, thank you. And it got rearranged on my list then. So did I miss anybody besides AT and Rebecca? Okay, then and then AT, I'll let you and Rebecca introduce yourselves now.
Sure, be happy to. So just to start, I'm AT Stoddard with LSC Transportation Consultants, and I'll give you a little bit more on my background and our firm, but I'll let Rebecca introduce herself. She is relatively new with our firm, but several years experience. So Rebecca?
Yes, hello everyone. My name is Rebecca Martin. I am a transportation planner with LSC Transportation Consultants. Excited to be working with all of you.
Terrific.
Thanks. So as I mentioned, I'm with LSC Transportation Consultants and been with the firm about, I guess, 35 years now. was a principal of the firm and transitioned out of that and take on some projects, still working. And my background has been in transit planning, and it's been quite a few years since I worked in your area, but I did do some work with Mason Transit at one point, and Squaxin Island, Macaw, Quinault. So I've got at least some familiarity with the area and some of what's going on there, and happy to be doing some more work with you in the area. Our firm has done a lot of these kinds of coordination plans across the country, and a number of them involving coordination with tribal transit programs and rural areas and urban areas. And so I think we've seen a lot of the mix. The one thing that I've referenced a lot of times is just the Kitsap Transit worker driver program, which is very unusual, and I've suggested that to some other places that's a good model to consider. So with that, again, our office is in Colorado Springs technically, but neither Rebecca nor I work there in the office. We both work remotely, and I actually started that well before COVID, but with COVID, we've transitioned to a number more of our employees working remotely, and with what we do, that seems to work well. So with that there, I think we've gone through the introductions, and the next thing on the agenda was Thera's going to give some background on what we're doing here.
Yeah, that sounds great. So I'm going to do a little screen share. Now, most of the meeting today is going to be you all talking, but we are going to do a little bit of presentation up front. And so I'm going to share my screen, and just hopefully this will pop right up. And hopefully you're seeing just some project contacts. Does that look right? Is that what you all are seeing? I hope. Just you're going to see these names a few times. So you just heard from AT, me, Rebecca. This is your team who's going to be working on the Human Services Transportation Plan update. Today's meeting is being recorded, so we will post a link to it on our PRTPO.org website. And as the project gets going and we have materials and resources for you, you'll find those there as well. And so here's our contact information. I wanted, because a lot of you may not have been involved with PRTPO for a while, or may not have know anything about us, I wanted to take 1 minute and just explain what PRTPO is. We are the Regional Transportation Planning Organization. It's a state designated organization for the 4-county region of Clallam, Jefferson, Kitsap, and Mason counties. PRTPO membership, we have 27 members from counties, cities, tribes, transit agencies, ports, and the WashDOT Olympic region. We also have the lands of 5 of our tribal nations are actively involved with PRTPO. There are 5 others who are not active, but they participate at various times in our processes. So we have a total of 10 nations, 10 tribal nations in the region. If you haven't been involved with PRTPO for a while, there have been some changes. So the last time you did a Human Services Transportation Plan update was in 2019, and at that point, PRTPO is still managed by WashDOT. PRTPO is an independent organization effective July of 2019. It is the lead planning agency is Kitsap Transit. The fiscal agent is Jefferson Transit, but the work is directed by that PRTPO executive board made up of these members of the organization. So if we approach things a little bit differently this time around, that it might have something to do with that. So for those of you who maybe haven't been involved in an HSTP process before, this is one of the requirements that PRTPO has, and it's a very specific kind of a plan. So PRTPO does a lot of different kinds of plans, but this one is really targeted towards the mobility needs of seniors, people with disabilities, and people with low income. And then, so that's what our federal requirements are, but then PRTPO as an organization is also interested in mobility issues that might be unique to our tribal communities, to veterans, and to those populations that don't speak English. So that's a little bit above and beyond what the federal requirements are, but important for this region. when we talk about human services transportation plan with our policymakers, this is some of the background that we give them, that when we're talking about human services, like if you look around the Zoom room, you don't see any roadway engineers here. And that's because we're dealing with a very specific kind of mobility. And so we're looking at, in terms of human services, the sort of those basic needs that we all have in life that, you know, that are provided though for people, whether it's housing, food, medical, healthcare services, education, job training, access to jobs, those types of things for people who, you know, have special needs or you know, have and social services available to them. Those services can be provided by public or private or nonprofit or tribal partners. When we talk about the plan itself, that's why you all are here, is you are the providers who help connect those people who do not drive with these services that are available to them. And so when I think about everything that PRTPO focuses on, this is just one aspect of it, but it's probably the most direct, sort of personal, meaningful type of mobility that we plan for as an organization. The objective of the HSTP is to make sure, again, that that safety net is there, that we are planning for everybody, regardless of age, income, or ability, even if they don't drive. And so especially when we think about a rural region, like much of this region is, it's simply not, you know, it's really hard to get around if you don't drive. That's the nature of these rural areas. And so it takes some extra coordination and collaboration among services to help meet the mobility needs of these folks. Now, when PRTPO looks at it, what its role is as a regional planning organization is to complete this update in a way that helps you do what you do. PRTPO doesn't have a lot of resources that it can bring to the table, but what it does have is a table like this that all of you can come together around. And so if we can, through our work at PRTPO, support what you do, enhance coordination and communication and collaboration, help build new partnerships or identify new innovative opportunities, that's what we're hoping, you know, to get out of that for PRTPO as an organization. And today, which is why we've brought you all together now at this part in the process, we are hoping to enlist your support in helping to complete this update. And we'll be really mindful of your time. We know that you have a ton of stuff on your plate, so we'll be very respectful of your time. We need you to help us to refine our understanding of the mobility needs and service gaps in the region, and to help us identify opportunities to support or enhance that service delivery. Nobody knows what the needs are out there better than you all as the service providers, and nobody knows where the gaps in that service are better than you all. So when we think about you know, why should you want to come to the table and be involved in this and all? I want to be really clear what we're using the HSTP for. It is, at its most basic purpose, it identifies the priority strategies that end up resulting in bonus points to projects that get submitted for consolidated grants. So it is, the strategies that come out of this will inform the priorities that PRTPO, when people submit applications, when you all submit applications for consolidated grants, this will be used to help prioritize those within this region, and that results in a certain number of extra points being awarded to your applications in a statewide competitive process. And I want to be clear too that while WashDOT has a consolidated grants process where you don't really need to worry too much about the color of the money, some of that money has a requirement associated with it that your project, your strategy that it supports must come out of an adopted plan. And so for a lot of the funding sources that you're interested in, this plan really matters for that, for eligibility. We will complete this plan. The board will adopt it in October. We will have a draft plan on the streets by the end of August. Our public comment period on the draft plan will be in September. And we know that the consolidated grants process is going to launch right around that time. So we hope to have enough of this ready to go by the time that that consolidated grants process launches, so that you'll have clarity when you put your own applications together about consistency with and coordination with this plan. And if that sounds like a lot to get done in a really short amount of time, it is. But the good news is that we're not starting from scratch. This is one of the periodic regular updates of the plan. And so we're starting with what was done in 2019 and refreshing and updating that to better align with the way the world is today for all of you. There are multiple pieces of this that are going on in the same time in parallel processes, because again, we have a pretty compressed time frame to do this in. We are in this stage right now of we're collecting information, updating information on mobility needs in the community, the services that are available to support those needs, the gaps in that service. All of this is background information that's going to go into the strategy development and prioritization. We're going to share data with you. We'll have some data and maps and things for you as well. That all of this is being developed right now, sort of all in parallel to each other. And it's why it's so important that we have your input now. When we think about it, though, it's really a pretty basic process. And I think you'll hear as AT and Rebecca take you through this. What we're doing right now is really, again, making sure we understand why is it that people need to travel, and what are the resources, what is the inventory of services that you all provide to help meet those needs. When we look at those, then we'll be able to identify gaps in service. Where is service not being met, or where do we need to have sustaining funding to provide that service? We're like programs that are supported by consolidated grants. What are those gaps? And the barriers that people are trying to overcome. And then out of that, then we can identify the strategies to fill those gaps, and and of all those strategies, which ones are priorities and why, so that we can make sure that as to the extent practical, we can direct funding towards those types of activities that will generate the greatest benefit for you, your organizations, and then the vulnerable members of the public. What's different this time around than previous ones is we're still in a pandemic. And so we're going to be also trying to pick your brain a little bit about just to understand how COVID-19 affected the services that you provided, the demand for services that you got. I've already heard some very interesting things about unexpected shifts where people are going like, I don't know if I want to ride in a group vehicle, and so how that and changed demand for private transportation. So there's some things that happened that all of you had to respond to and adapt to. And it's far from over, but we're hoping to pick your brain a little bit about what you might be planning for, what you think might be some lingering effects that you're going to need to accommodate over the next few years, a year or two or four, however you're thinking about this. So any insights that you have, we'll also want to pick your brain on that. The products that are going to come out of this are pretty straightforward. There's going to be the strategies. These strategies are going to guide PRTPO's prioritization over the next 2 consolidated grant cycles. So the one that's coming up, as well as the one that will be conducted 2 years from now. So these priorities that we're identifying right now really matter for funding over the next few funding cycles. There will also be data and mapping products coming out of this that you can use when you go to complete your reports, when you go to apply for grants, tools that allow you to sort of communicate the population that you're serving, the region that you're serving. So we're hopeful that this will be something with lasting value for you going forwards. Our primary product is going to be an online story map. In years past, we've had, plans that were 200 pages of printed stuff that nobody ever looked at ever again after the plan was done. And we just think that the way we roll now is that we want something that actually has value beyond this process. And so we're going to try to create a very user-friendly online story map with data embedded in it that sort of really conveys the importance of the work that you all do in meeting the needs of the most vulnerable members of our community. There will also be a technical appendix for those of you who like that dry, technical stuff that satisfies WSDOT's reporting requirements for the Hstp. And maybe there'll be some other stuff that comes out of this. As a PRTPO coordinator, I'll be listening for ideas to take back to the board, to suggest to them activities that they may be able to support going forward in their work program to help you do what you do, whatever that might be. So I'll be listening for that. I do want to also add, because I don't think we'll mention it again today, but you'll hear about this from me going forwards, is that this story map, I will be turning to you looking for images or stories, anecdotes, vignettes that we can use to really make this plan about this region and to tell your story as effectively as we can. So you'll be hearing from me more about that in the future as we try to get some of that information from you, but I wanted to go ahead and put that bug in your ear now about that. So before we move into like what's really the meat of this and the discussion, are there any questions just on the background of what we're doing and why we're doing it, and anything that I can answer so that everything else that you hear and discuss makes sense? I know you'll come in with a lot of different backgrounds. Any questions I can answer? Okay, super. Well, and anytime. Oh, Amy, yes.
Sorry, I was trying to hit my unmute and find my raise hand button. I'll just do it manually.
That's perfect. That works.
I do have a question about the story map and that presentation. As I've been working on the 5339 grants and needing to upload documents to that and reference page numbers. Will that story map allow us to do that, to be able to download it as a document and reference it?
You'll be able to reference the technical appendix of it. It'll have all the same information. It just won't have the touchy-feely stuff part of it. The story map's more the public facing, but that's what that technical appendix will give you, the data points and the pages that you need to be able to reference like that. Okay. So, the story map may as well. That's not my forte. I don't know how to do that. So it may also allow itself, but I do know the technical appendix well.
Okay, perfect. Thank you.
Yeah, thanks for bringing that up too. Those are great kinds of things. Think about, as we're having these discussions, what kinds of information you need for the reporting that you do or the grants that you write, so that we can have that in mind as we go forward. So thank you very much for bringing that up, Amy. So with that, I'm going to turn it over to you, AT, and take it away.
All right, great. Thank you. I'm going to just share a few slides here partly to share some information as well as to just keep us on track here. So the first one I've got is just kind of takes the schedule that Thera just showed you and breaks it down a little bit more in terms of our process and things we'll be working on. I'm not going to spend a lot of time on this. Certainly if there are questions, we can address those, but this fits within that schedule that Thera just shared, but breaks down a little bit more some of the key things that we'll be working on. And so just to begin our first task, we've identified the mobility needs assessment. She talked about that, and the inventory of transportation resources. So those, we've actually already started working on that portion. We're doing some questionnaires. One of those will be the inventory of transportation resources that is near ready to put out. We will put that out in an online format, and that will be for all of you that are involved in providing transportation services in one way or another. It may be just if you even refer people to other transportation, or you provide funding but don't actually operate. We want to have that broad picture. Obviously, if you're a transportation provider, actually operate vehicles, we'll have more detailed information that we need from you. So those, with the mobility needs assessment, we have a community survey questionnaire, and again, that is going to be set up primarily for online response, although we'll have a downloadable, fillable PDF version if people would prefer to use that for reasons that they may not want to do it online, or may need to just get somebody to print it out for them and then get it back to us. So those two tasks, as I said, are underway. Our target is to have an interim product or report in about the 3rd week in May. We will be sending that out. The information will be there. We will want your feedback, and I'm going to share a little more again on the next slide as well. But what we're looking for is you to review particularly your information, and then you might look at the summary of the needs. You can review everybody else's information if you want, but again, we want to get this out because we'll be using that information as we go forward and identifying gaps and looking at strategies. So it's and as I said, it'll be an interim report. It's an opportunity to get that feedback, make sure your information is interpreted correctly as we put it into the plan. And I guess partly an answer to Amy's question, we'll be sorting out how we put this into that story map format. But again, obviously we'll have databases and things backing that up, and there'll be other information available. So Rebecca and I will be working on what goes in there, how do we present that, that as we move forward can be into a plan that is easily accessible to the public, but then also has all that detailed information. So the next task, task 4, is we'll be identifying those service gaps. Again, we'll be starting on that as we start seeing the needs, the input from you, and the existing resources. And we will have a second interim report in June. And this is where we anticipate having another meeting with you. We'll have identified those needs, resources, what we see as the gaps. And our 5th task is to develop the various strategies. So we'll be working on those. And at that June meeting, we'll look to present what we see as possible strategies. We won't have completed the evaluation of those. We'll want to have some discussion, how we think some of those strategies address the needs, but get a lot of your input. There may be something that we have that you just don't like. We'd like to hear that from you. It may be something you think is great, and we'll want to hear that from you as well. So that'll be a working session. The plan is for that to be this format as well. I'm guessing some of you that are in more remote areas are really happy with at least the side effect of COVID, that you don't have to travel to every meeting anymore. There are downsides to that as well. But I think all of a sudden, we found that virtual meetings can handle a lot of the things we need to do. So that one we plan to do as a virtual meeting. Through the process, we probably will be following up with a number of you individually, just from the information you give us, and reaching out to make sure we really understand what you're giving us and have a good interpretation of that. Following that meeting in June, we'll finish that evaluation. We will be putting together another interim report, and again, probably we'll be using the story map format, but also having backup information, and that will be the evaluation of those strategies, and we'll want your feedback again on that. Before then, we proceed to putting together a draft plan, and that draft plan target, again for August, we'll be looking to hold a meeting with you as a group to review the draft plan, but also then that community outreach. And that will extend, and the final plan, everything wrapped up. Basically October, I think we have November for final submittals of things after the board has reviewed it and approved it, and there may be any final direction. So that's, again, overview of the schedule without repeating too much of what Thera shared, and without going into too much detail. And at each step, when we meet again in June, we'll kind of review the schedule, where we are and what's yet to come. But let me go to the next slide, because I want to just reiterate what we're looking for you to do in this process. The first one, the most important, is feedback. As we come out with these interim reports, and both in the documentation, but also in the story map, we want your feedback at each of those steps. And so again, the first one, the inventory, you can look at it as much as you want, but the focus will be make sure the information we have about your services is accurately portrayed. immediate assistance we need are in these two survey questionnaires that will be coming out. The first one is transportation providers, resources, that inventory, and we're asking everyone who is involved one way or another with transportation services to give us that input. So it's going to be just basic organizational information, what services you provide, but particularly unmet transportation needs. What do you see from your organization standpoint? What are those unmet transportation needs? What services you provide? Are they limited to certain clients, specialized transportation, whatever that may be? And then finances and other resources you have. And for those that the public transit agencies, we're going to kind of shorten it and not have you provide so much of the detail, because some of that we can get out of your NTD reporting. So we'll go to that, but some of the things, and particularly we're trying to look in some cases, what were things like pre-COVID and before the pandemic, and what has happened and what's happening recently, so we can get a picture of that as well to incorporate. So that questionnaire will be out shortly. We'll be sending that again with the online link to respond to that. And we're asking you to reply and send your responses by May 13th. So almost a full month, not quite, but certainly time for you to put that together and get that information back to us. So that's the first immediate request we have. The second is the community survey. And because the focus of this plan is on human services transportation, the best way to reach out to the people we're really trying to involve is through your agencies and your programs, because you have contact with people that need the transportation. As Sarah said, it really is focused on some target populations. And so what we will want is your help in promoting and distributing that questionnaire. So we will get it out to you. We'll have the links. We'll give you some information that you can provide. A lot of times what we do is create the QR code, and you can display that. People can respond. We're keeping it relatively short. We do ask some basic demographic questions so we know who the people are that do respond. We ask about what services they currently use or may not be able to use, and what their needs are, and if they have needs that are not being met, either for particular types of transportation or services or times of day or destination. So we will again have that ready shortly, and we'll be sending that out. And that again is an area where we really need to have your assistance to promote that as broadly as you possibly can. So if you have with your vehicles, if you could put the information on there, asking people to respond and provide input, that would be great. You've got it on the website or mailings or emails that you send out. Again, that would be a way to reach out to folks. So let me just pause there and kind of, we've seen the overview in our work and where we see you fitting in, and see if there are any questions there before we dive in. And this is basically about the end of the point where we do the talking. We're going to transition in and hope to listen to you next. But any questions on this that I can address now? And certainly if you come up with others later, you've got contact information, you can contact us. So I don't see anything. Oh, I see Amy is raised. Oh, you found that I raised my hand
On the button.
Yes, okay, good. Popped up.
Can you refresh my memory on when you expect to have that community survey out and circulated?
I would say fairly soon. I'm hoping maybe this week. We've got a second, third version. Sarah's reviewing. Rebecca's actually started coding the online, so we can make any minor changes. And I mean, Sarah, maybe, I don't know if you want to comment on when you have it back, but we will be set to have that up and ready fairly soon. You know, and again, hopefully this week even.
Okay, I asked because there's some work that the State Transit Association is doing with the Washington State Department of Transportation on developing a community survey that we're going to have to work to put out later on this year. related to the transportation grants that were part of a recent funding package that our state is set to receive. So I'm just thinking about the number of surveys that we're going to have to put out there and if there's going to be any confusion, but I don't think we're going to have those questions developed until later on this summer. So maybe there will be enough of a pause between the two surveys for us to have not confuse people. So
right. Okay, good. Yeah, it sounds like that probably is the case. And again, this one, if you can focus on getting it out to those people who need specialized transportation, seniors, people who may have some type of disability, the low income. So yeah, hopefully it doesn't result in confusion. And we're keeping ours fairly short, I think, too.
Amy,
hey, anyone else question? Yeah, Sarah.
Let me just clarify with Amy. Amy, is that it's for all general transit ridership, or is it also targeted towards the same population we're looking at for HSTP?
It'll be all transit riders.
Okay.
So both populations are, those that are on fixed route, those, I mean, it's the whole population. So.
Okay, thanks. And I think Nancy had something too.
Oh, okay. Yes, go ahead.
I just wanted to check, because of the fact that, virtually all of our clients are seniors. Many of them are not computer savvy. So if we need to get a questionnaire responded to, they would not know what to do with QR codes or any of that. So I assume you would provide us a paper questionnaire perhaps, or?
Yes, we will produce a PDF version that you could print and scan and send back, which would be the easiest for us. Or somebody could enter it if they wanted to fill it out and you had somebody that could enter it online, that would be great too. So we'll have multiple options. Our preference obviously is online, but I understand a lot of seniors don't have access to that, don't know what the code is, or don't want to put their information on the internet. I understand that. And so we'll have that a PDF format, and if you need to print it out, you'll be able to do that. They can handwrite it, scan it, and send it back to us.
Okay. So you would want us to send out the questionnaire, give them a return envelope to bring it back to us, and then we would scan it to send it to you.
Let me know, because we can work with you. You could, if they're going to mail it back, we could set up so it gets mailed back to us rather than, having multiple steps. We want to make it easy. And so that's the kind of thing that if, having it and printed, if they're not coming or you're not having contact with them where they can do it or hand it in, we can figure out a way to do that.
In some cases, we might just need to administer it over the phone to some people to improve the percentage of responses that we get.
Yeah, if you can do that, that would be great as well.
We just have to find a volunteer to do it.
Right.
Nancy, we'll follow up because I want to make sure that our process accommodates your, what your reality is. So we'll circle. I've just made a note. We'll circle back. We'll find an easier way for you guys, for your clients to participate. Okay. And yeah. Because I don't want to. Yeah, we'll find a way.
Right. Yeah, which is exactly why we want to work with you, because we probably could not reach most of those people on our own. Right. Where you have that, and then we can figure out how to do it. And for different agencies, it's going to be probably a little different approach. Yeah, any others, if you've got special ways we need to work with it, let us know, because we can do that. All right, let me go to the next slide and the next item on our agenda. And this is really the bulk of our remaining time, and that's to look at what are the study issues and goals. And so we've got 4 open-ended questions here. I'd like to take these one at a time, but if somebody jumps down to the third bullet there, that's fine. I'm not going to cut you off at all. But so the questions really are, from your standpoint, and with the people you serve, what do you see are the greatest unmet transportation needs in the region? And then the second one, what coordination efforts are going well? Are there things that are being done to coordinate services, whether that's a referral to an agency that provides transportation, could be any number of things, but what coordination efforts are going well? What services do you think should be enhanced? And then are there coordination strategies that we ought to be exploring in this process? So fairly open-ended, and I'm going to turn off the screen sharing. You've got this on your agenda as well. And try to start, and as I said, we'll sort of go through and keep it somewhat organized, but if you want to tell me here's the greatest unmet transportation need and this is the service you think that needs to be enhanced, that's fine as well. And it's being recorded, so we'll have that. Rebecca and I will be taking notes as well as we go through, and may follow up questions to you to make sure we understand what you're pointing out. So with that, just as I said, I don't want to spend the time talking now. This is your chance, and tell us what do you see are the greatest unmet transportation needs in the region?
I'll jump in from Dina from OLECAP, Clallam and Jefferson counties. I'm going to say some of the biggest struggles we have are more remote areas like Nia Bay, La Push. The bus service is so limited. There's if somebody is realistically wanting to go to work outside that area, they need their own vehicle to make it work, and that's not affordable for many people. So increasing the services out there, or having extra vans that can run in and out to bring people to transportation, that would definitely help. And also, particularly in that area, there tends to be a lot of road issues like slides that will shut down roads. So either knowing alternative routes to get around that are viable. And again, if you have your own transportation, then you're going to have a decent vehicle that can handle these logging roads. But to have that be doable, because yeah, it's when you're considering that it could be several hours to get to work, that's just not realistic for most people.
Right. All right, great, thank you. So someone else.
Yeah, I'll go next.
Jason, okay. I thought maybe I saw you wave your hand there, but I wasn't sure. Yeah.
I think what we see in Mason County is we have seniors here that are needing to go out of the county for those specialized doctor's appointments, to Kitsap or even to Jefferson, also to Olympia. We used to have a volunteer driver program that was highly successful, almost overly successful, in a way where we had way too many clients needing this transportation and not enough volunteer drivers to meet the need. We've since given it up because we weren't able to manage it. But I think that if there was a way that we could coordinate our use of Dial-A-Ride to, meet up with Access, for example, for Kitsap, and do a handoff there. We do have routed service that will cross that line, but a lot of those seniors, the idea of switching buses 3 times to get where they need to go, especially in this climate, is not something that they want to do. So if we could somehow incorporate, or even, get back to using our normal day resources to fulfill that need, I think that would be a great win for us. I know that there's a huge population that's looking for that kind of transportation need to be met.
Great, thank you.
Jason, can I just confirm, so you could, what you're talking about is, getting those connections out of your service boundary, out of your PTBA, with direct, without having to do any sort of, like what a typical person would do for transfers. And so also with intercity transit then also, right?
Correct. Yeah. We have, going to those bigger medical.
All around.
Yeah,
Okay.
exactly. Everywhere.
Perfect. Thanks.
All right, who's next? Let's see, Nancy, waving a hand, okay.
Okay. I want to follow up on what Jason was saying, because we do run a volunteer program, a volunteer-based program to get people across state county lines. And I would say probably since we're the only agency in town doing that, I believe our special transit, it only operates within the county. So we get people to swim Port Angeles, certainly Kitsap, sometimes to Pierce, but there is a real need for transportation to Seattle. And that was one of the toughest things for us during the pandemic, because we were able to keep operating with very strict protocols on masking, desanitizing, etc. But the truth of the matter was, people didn't, I mean, volunteer drivers simply did not want to sit in a vehicle for 2.5 hours with someone during a time when we had, infections. So all I'm saying is, from my point of view here in Jefferson County, access to medical facilities outside of the county is one thing, but probably Seattle is the biggest issue.
Great. Okay. Thank you. So let me ask, a lot of your volunteers, seniors that
yes,
we're concerned about that, right? Okay. Yeah. I mean,
exactly.
we've seen that elsewhere. Yeah. Yeah. That was a big issue. Great. Thanks. Okay. Who's next? All right. D, I see D's hand waving. Good.
One of my biggest issues is vehicles. The vehicles I have are 2008. The money that I've received, I'm getting money for wheelchair accessible vehicles, but not all my agencies need wheelchair accessible. They need a minivan or a sedan, something smaller. So it's not a large wheelchair accessible vehicle running all over to transport, just a couple people.
Right. Okay. So these are other agencies, and you're providing the vehicles to them for them to operate. Right. Great. Okay.
Right.
Yeah. All right.
So I issue vans to social service agencies. They provide the drivers, and then they transport their clients to wherever they need to go.
Right.
But I just don't have the correct size vehicles for the need.
Good. Okay. Good to know. All right.
Actually, let me ask Dee a follow-up question. Do your drivers, if they're operating, or the agency drivers, I should say, because I know it's not your drivers, do they need to have special certifications also even to operate a wheelchair lift? I know they don't need it, but does that even raise another level of complexity that even if you gave them one, could their drivers operate it, or does that also require special training for them?
I put them through the training.
Okay. Okay.
So Beck, looks like your hand is
I do.
up.
I have
Yes.
I have a question that I don't know if it fits into your discussion or not, but Dee, when I listened to you talk about the actual vehicles, it brought to my mind as the difficulties that most of our nonprofit agencies and our tribal agencies have now getting vehicles for transportation is important and is stressful, and we hear it every time we go through the grant application. But my question is, what are going to be the requirements, and how difficult will it be for your agencies if you're required to move to electric vehicles? Because it seems to me you have trouble now just getting used gas-powered vehicles to meet your needs.
Yes, we are having problems getting vehicles just because there's nothing on the state grant right now or the state contract. So we're having problems getting vehicles. I think if we went to electric vehicles, as of right now, Kitsap Transit pays for the fuel for these vehicles. So we pay for the fuel, the maintenance, the agency pays for the insurance. And so if we were to go to electric vehicles, from my understanding from our maintenance director, when these vehicles come, they come with the plug-in, and it will monitor the kilowatt usage So we will be able to reimburse them for the usage. And instead of them having a fuel card, we'll pay for the electricity. That's our plan. We don't know if it's going to fly yet or not, but.
All right, good. Thanks.
You got some comments in the chat box too. AT.
Yeah, right. I
Elizabeth
was
said
looking at,
something,
yeah. So yeah, I thought, one is unmet transportation needs hospital to home, which often the case. People can get to the hospital and then a ride back. So then let's see. Okay, Forks, Port Angeles. And then D said you also have volunteer drivers, and that, let's see, finding volunteers to meet driving eligibility in the needed areas that can work on a regular, dependable schedule is hard. Also, having funds to pay for drivers to provide incentives may help. And then another comment, not enough charging stations on the Olympic Peninsula to make it viable for electric vehicles. That was going to be one of my follow-up questions. In some of the areas on the peninsula, are electric vehicles viable, particularly for giving rides to people?
I will add that there are separate efforts underway right now, very concerted efforts on the part of most of the organizations, many of the organizations that are on this call, but different folks in there, to get more charging stations, both DC fast charge as well as level 2 chargers on the 101 loop, as well as SR3 and I believe the 104 corridor. And there are funding programs, their applications are open right now, and the 101, the Olympic Peninsula is considered to be a high WSDOT priority. So there will be opportunities. There's also a funding program out there right now to put electric vehicles into low-income and underserved communities, both in charging stations as well as a vehicle share program. So if anybody, this may be way outside of any of your boundaries, but if any of that sounds like something you kind of go like, I want to know more about that and who in my organization is doing something with that, if you get in touch with me afterwards, I will try to hook folks up. But there's a lot of money going into electric vehicle infrastructure right now and electric vehicle programs in general, more than we've ever seen before, ever.
I'm going to jump in because I saw Patty Perry waving her hand and she hadn't been recognized.
Oh, I'm sorry. Okay, thank you. I missed you. I'm sorry, Patty. Go ahead.
That's okay. I just wanted to say we recently, and this might be a help to somebody else, we recently received a contract with Mason County Behavioral Health Transportation in Mason County. And it's to help individuals that are in rehabilitation, counselors, appointments to work. I mean, it goes to medication, to several different individuals and what their needs are in Mason County. We also have a contract with Medicare when you guys are talking about helping individuals out of Mason County. We have serviced individuals clear up to Bellingham, to Forks. That may be on Medicare, on Medicaid. I had searched and searched and searched for a long time to help people on Medicare, and it's very, very difficult. Fortunately, Kaiser Permanente, with access to care, has started helping individuals that are on Medicare, which is wonderful, and we have a contract with them. So anybody that you know that are on some of these insurance companies, ask them if they have, if their insurance company provides them with a certain amount of free trips, and contact access to care for that. Other than that, as far as Mason County goes, again, I've been searching out and trying to help these individuals. Seniors, a lot of these seniors go out of town and I am planning on just doing group rides with them in certain areas. So again, it's probably the same thing with everybody else. Vehicles, I have at the moment like 22 employees and 12 vehicles. I have 4 wheelchair vehicles and the rest minivans and sedans. But I need more vehicles. So
Okay.
I don't know how it used to be. Oh, it used to be that PRTPO was, the way they did their funding was a matching grant. Is that still the way, or is it different than it used to be?
It's still, it's set by WashDOT. So PRTPO has no money itself to offer, but the WashDOT consolidated grants process is where that money comes from. And it does typically require a match, but I think the match, and Elizabeth Safston, I might put you on the spot here for what the bit that you can answer on consolidated grants. But I think if I remember right, the match requirements are prorated depending upon the size of the organization, or if I don't know that it's a single set, but as with any competitive grant, of course, when it gets down to it, there's more requests than there is money, and they do tend to put a lot of weight on the match requirements. So, but PRTPO itself doesn't have that requirement for match.
What I'm finding out as far as, and I searched into electric cars, but sometimes with the distance that we have, a lot of these electric cars don't go that far. So that's going to be a problem with us. But other than that, I've definitely researched into it.
All right. Good. Thank you. So let's see. So, Beck, is your hand up again?
I got my hand raised again because
okay.
See, I got thinking about this. Sarah knows it's dangerous when I get thinking. But when we talk about the unmet needs, or what services are we not provided, I started thinking about just the location, and are those services less available on the west side of the Olympic Peninsula, or down from say Quilcene to Hoodsport? I'm trying to think physically where we have gaps in addition to needing vehicles and providing services to, I realize they're rural, but they're still closer in than somebody down on the Hoe or out in Forks trying to reach medical services or even get to and from jobs. So I guess my question is, where are the gaps physically?
I don't know if anybody wants to address that. That's one of the things we'll be looking to try to identify, and that's one actually that can be mapped. So we'll be working on that. But I don't know if anybody has any comment on that at this point. Yes.
I would. This is Dina again. I would say some of our areas is not only just on the 101, but it's on the roads going to the one. It's from the Nia Bay. It's from Nia Bay coming to the 101, and Clement Bay and La Push, and the sites outside where a lot of times those vehicles are going to be overnighted, needing to have that electric services there. And the other thing that I was going to mention, another issue, an unmet need that has been mentioned at previous meetings, I think, is because a lot of times the people are coming from Nia Bay or La Push or even Forks to Port Angeles, Port Townsend, there's not a lot of availability to go to the bathroom. So having, if you're on a bus, you can't tell the bus driver, hey, pull over, I gotta go. Having stops available or something, or rest stops available, that could be a huge need, I would see, for people.
Good. Great. Thank you.
Can I want to ask the group, because we
Yes.
have, because we've got some folks like Elizabeth and Linda who are coordinating medical services with providers. I'm curious if there are any special needs that you all have, as you don't, and correct me if I'm wrong, but my understanding is you don't actually provide the transportation services, you provide the human services that people are trying to get to, the medical services. And do you have the information that you need to help coordinate those rides for your clients to get them where they need to be when they need to be there? Do you feel like you have adequate resources or information, or you know who to contact? I'm kind of curious how this looks to the two of you who are working more on the human services side of things.
I'd be happy to address that. This whole operation we have going on here at the Jamestown Healing Clinic, it isn't even open yet, so we don't really even know what our needs are yet, because we don't know what our client base is going to be yet for sure. We are providing transportation. We have 2 vans that have been provided to us through the tribe. And so they're both 14 passenger vans, and they do not require CDL. We do have 2 drivers hired that are right now being trained. And so we do not have any mobility vehicles. So that will have to be contracted out if we have someone with a motorized vehicle, wheelchair, or even if someone can't go up our stairs, we will have to be contracting out for that if we have that need arise. But we're still a few weeks away from opening, so I really can't address that yet.
Okay. And Elizabeth, I know you've got the Macaw's transit system out there. Do you have other providers then that help members of the Macaw Nation access? I saw your comment in the chat about, you know, the long distance, trying to get people home after, you know, they've had medical services. Do you have the information you need to match your clients with the mobility services that they need? And if you're on, you're mute. Okay, sorry. It's bad when I call on people without them knowing I'm going to call on them. So, but I'm kind of curious of what it's like on that end of things, to know how hard that is to connect with those of you who are providing, you know, many of the services. So, okay, thanks. Sorry, thanks for humoring me there, AT.
Sure. Oh, yep. Oh, that's what the time is for. Any other, in terms of just unmet transportation needs, or maybe we could go to the next one, just what coordination efforts are going well? It sounds like there are some. We've got agencies providing vehicles. Dee said you're providing vehicles to human service programs, and they use those. So there's a, you know, that's a coordination effort. Are there others that you would say where coordination is working well between agencies, whether it's between transportation or transit systems or human service agencies, whether or not you provide transportation, are you funding? Just any examples of what you think right now, cooperation, coordination between different agencies is actually working well.
Hey, AT, I think Linda,
yes, Ed.
I think Linda from Jamestown had a question before.
Oh, okay.
Well, it actually goes right along with what you just said. I am so thankful to Wendy that she hooked me up with this group, because just the pure time constraints of our operation, we will be bringing predominantly the same clients every day to receive their medical dose, because we're a dosing clinic. And I am a former Clement Transit driver. So I am well aware of how much time it requires to get out to Nia Bay and back. And we just do not have that kind of time. So I'm hoping that we can coordinate with the Macaw tribe and with anyone on the Hood Canal side of things, because our drivers can't possibly get there, get back here for their appointments, get back down to, say, Brennan, and then get the drivers here in a reasonable amount of time. So I'm hoping to do a lot of coordinating with a lot of the people I'm seeing on this list.
Okay, great. So that's my fourth bullet there. What coordination strategy we ought to consider, right? But great, good, thank you.
You're welcome.
So any others on examples of things you think are working well in the region?
If nobody from the 4 transit agencies is going to pipe up, I just got to say, you all, the 4 transit agencies in this region actually coordinate beautifully among themselves. So for those of you who aren't part of the 4 transit agencies, if you have clients who need to go long distances, there are some routes that are coordinated. They just do it voluntarily to create more of a regional system than we would ever have otherwise. So I'm wondering if everybody's familiar with how the 4 different transit service things interconnect, because if you don't know that they do interconnect, you should. For some of your clients, it won't work for everybody, but this region's got a pretty remarkable history of coordinating between the 4 transit agencies.
Transit agencies sometimes don't toot their own horn enough.
Mm-hmm.
I think in this region, though, we do need to take a better look at the Miller Peninsula and figure out how it's sort of impacted by being rural, but yet associated with 2 transit PTBAs. And something could be done to get ready for the increased residents, potential recreational activities that should be open to all people, and that we should figure out how to best serve the coordination issues between the paratransit services in that area. And I don't know if I've seen anybody here from Clement Transit on this.
They've got they've got an important board meeting at the same time. So
yes, okay, so then I will take it one step further and say that the way that Clement Transit serves the Diamond Point area is through a unique dial-a-ride service that allows for deviation. And then they interline that service with the Swim Shuttle as well as the Jamestown Slalom direct service that goes to the government campuses as well as the resorts. And so they're doing their best to create a high level of efficiency. But at the same time, I'm wondering if we were looking at cost per rider, what else can we do to increase frequency, increase availability, but not letting the cost per boarding skyrocket? And basically be ready when Miller Peninsula increases its popularity to tourism as well as increase residents. So wanted to contribute that from a human services transportation planning perspective.
Wendy, I don't know the area well enough. Where is Miller Peninsula? Is that just generally geographically?
It's everywhere between Swim Bay and Discovery Bay.
Okay.
In the lowlands, but there's a lot of people living up in the foothills in an area called Chicken Coop. So that's the other name that's affiliated with that.
I would say too, if you're talking about what was going well, I agree the coordination between like Clement and Jefferson has been great, and the opportunities they provide to connect with other places or, ferries, etc. But it was my understanding, not that I've ridden it, but I thought even during COVID that Jefferson, was it true that Jefferson was free for passengers? And that is huge for people. My son is now a bus rider, and that's an expensive, bill to take on. And I think that's great. Any efforts we can get to have that done, but that really helps support the community. And I want to give applause for that.
I'm going to add that yesterday our authority board signed a resolution for Jefferson Transit to be permanently fare free. So when we close out our emergency state, we will actually be fare free on all of our non-premium or express routes. So all of our fixed routes and our demand response services. I also wanted to just piggyback on Wendy's comment about the paratransit interconnectivity between our public transit systems. It can be a little clunky, and that's because paratransit is for our comparable ADA services. They're comparable, they're complementary to our fixed route. So they run within a service area corridor. And they often go on times, especially when you're out in like a rural area. It's going to follow the times of those services. So we have to coordinate those transfers for our time when we're going towards Clallam County, and when Clallam County or Clallam Transit's coming towards. And I think our best place to connect right now is Jamestown. So there's amenities there, there's a bathroom, there's snacks and stuff for them. But that can be a difficult transfer. So, there's always room for improvement. Dial-a-ride paratransit services for public transit is the most expensive service, because it's door to door, and if your productivity numbers aren't high for each trip. And during COVID, we really did see where we were doing like one person per trip because of social distancing. So that increased the cost even more. But, and then unless the agency decides to go outside of that corridor, so right now, I don't think Kitsap Transit has any fixed route buses that come up towards the Hood Canal Bridge that I know of. I don't know, Jeff, yeah, I didn't think so. So that means their access corridor doesn't come up towards the Hood Canal Bridge. And so our paratransit services don't connect. So, in the future, when we're talking about service planning, that's a big consideration as to how to increase those connectivities on the paratransit side too, because there are timing windows that affect how we schedule our manifests for that service. And then, we just did, I'm just going to plug it in here because it may become a permanent service route, but Jefferson Transit has implemented a express service to the Kingston Ferry. So there is an additional service there. And that's another way that we work with Kitsap Transit, connecting with their fast ferry service to Seattle.
Yeah, I agree with you, Miranda. We don't have anything up there to connect with you. You guys have to come into either Paulsbo or now Kingston, which works well.
Yeah, or the North Viking Center. That's where our number 7 goes, but it's a long way over there, and
we do go into that north area at certain times of the day, but we consider those outlying areas. And just like Seaback and other outlying areas in Kitsap, it's very difficult for people to come in. They end up spending the whole day out here, and they have to wait till certain times of the day to go back. So
yeah,
we could use improvement in that, I think. But like everybody else, we have other concerns like operators, which we don't have any of. And
yeah, even if we did have a service, could we even get people to drive it at this point?
Right. Yes. And then I just heard today that they're putting our bus procurement off another year. So we're going to be using the same coaches we have. So we got to take care of what we have, including the operators, because we're at 78% of what we should be for operators.
Everybody having that same challenge, finding enough operators?
Yes.
I see heads nodding. Yeah. Everybody I talk to seems to have that same challenge. And then I just saw it, last week, Walmart announced $110,000 to start driving for Walmart. And I thought, boy, what's that do for transit? So I saw it said Clement was free at the start of the pandemic. How about either Kitsap or Mason? Did you go to fare-free operations at all?
Yeah, we're fare free in county all the time, but we did go fare free outside of the county during the pandemic.
All right. And so you're permanently zero fare inside the county.
Correct.
In county trips.
Yep.
Okay. And how
Kitsap
about
Kitsap has not, although we're going to be implementing that new free fare for those 18 and under. I think that's a statewide initiative.
Okay. Okay. All right.
We were free fare for Kitsap was free fare during a little while during the pandemic, but went back to fares.
Right. Okay. Is there consideration to go with no fare, or going to stay with the fare?
No.
Going to keep a fare. Okay. Because that's a discussion a lot of places are having. I'm sure, as you know, that do you reinstitute a fare or stay with zero fare? Okay. All right. Any other thoughts on coordination efforts that may be going well in the region? Let's see, Elizabeth, you have your hand up.
So I guess I'd like to more pose a question to everyone here. What are your thoughts on transit to Tacoma or Gig Harbor? Because it seems we have ways to get to Seattle, we have ways to get to Olympia, but we have very, very limited ways to get to the medical facilities in Gig Harbor and Tacoma, and recreational, of course, but medical being a priority. And I'd be curious what you all think of that.
I agree with you, Elizabeth. It is very, very difficult for anybody in Kitsap County to get to Tacoma to go to Madigan, and that it is a very long day. So especially those that are in wheelchairs and that. We have one route that goes up to Pierce County, and that's 3 in the morning and 3 in the afternoon.
So at Kitsap Transit, we're updating our long-range transit plan right now. And one of the, we have 3 different service scenarios we're asking the public to look at. Most of these new service scenarios require additional tax dollars or other funding to implement. And one of the items in the service scenarios is a Bremerton to Tacoma service. And Elizabeth and I have talked about the need to stop in Gig Harbor, to also stop in Port Orchard, at Sedgwick, in Sydney. And in Tacoma, it would hit, depending on what final routing would be selected, it could hit the hospitals and then down to Tacoma Dome Station for intermodal connectivity. There's quite a bit of intermodal connectivity down at Tacoma Dome. It's also going to be a future light rail station to the north up towards SeaTac. So that's in our long range plan. So it requires additional revenue and then support at the board level. So we're looking at that in the future. We know Pierce County is a big employment center. There's lots to do there. There's medical facilities. And it was one of the first things I noticed when I moved to the region, that there wasn't adequate connections down to Pierce.
With regards to Mason Transit, we do have a large population of riders that are looking to get to American Lake for the Veterans Hospital too. So that would definitely be a huge access point for us.
Right. Any other veterans transportation issues? There did mention veterans, and that hasn't been brought up by anyone until now. Is that?
I don't think we have like DVA on the call or anything.
DAV,
no. DVA or DAV. What I can say that it's important to note in the plan is that for some veterans, they can get reimbursed their travel costs. So if they have a disability rating, there's a program to reimburse their travel costs. But I think we need to reach out further with some of the volunteer groups, but also with the Veterans Health Administration.
Yeah, I came back on to also mention that that the Veterans Center has transportation vehicles, vans. And also I think Catholic Community Services is not here, and they have tour services that extends to elderly and veterans and whoever. So yeah, I'm not sure how their equipment is working, but they are providing service to American Lake. And I think that Port Orchard and Kitsap Transit helps out the veterans over on in their facility over in where Beck lives.
Yeah, the state home.
Annapolis area.
Yeah, Retzel.
It's Retzel.
That's
Retzel
it.
Veterans Home. Yeah.
Yeah, Retzel does have 2 band-link vans that they transport their clients to Seattle and down to American Lake. So works out well.
I'll say that when I was trying to understand what mobility resources are available to veterans, I went to each of the 4 counties to see what they have in the way of veterans resources. And I found a lot of information for the North End, for Clallam and Jefferson. I found some information for Mason, and I found hardly anything in Kitsap. So I'm kind of curious, as the service providers, do you all get many referrals, or either, you know, from people trying to make a veterans mobility trip, or just end up, you know, with those requests that you just can't fulfill? Or do veterans tend to know where to go to get their services? Is that something that comes up? And I'm thinking in particular for some of the longer distance trips, is how does that work for you all? Do you get those kind of calls?
I do not.
Okay.
You know, like I said, the Veterans Home does have the 2 vans. I do see several veterans vans running around town, getting off the ferry and stuff. I don't know who's got those vans. It just says disabled American vets.
Yeah. Yep. Yeah, they're good. Yeah. Well, certainly as we go through this, if you have any insights about how veterans' mobility needs are or are not addressed in this planning process, feel free to share that. I know it's sort of a different, unique, and it overlaps with a lot of the other concerns that we have, but they're also sometimes where they're going, or the conditions, you know, that they need to travel within, or whatever, just different sometimes than for the general public.
And Tara May, I will get with you on what you have found out, or with the various counties too, and get that from you. Good. All right. Any, well, we've talked about some, I guess, on the 3rd item I had there. What services maybe should be enhanced? Any additional thoughts on that? I mean, we've covered a number of those as we were looking at these others. Some of those were brought up, but give an opportunity to see if there are any other specific services you think we should be looking at that maybe should be enhanced. All right, I am looking to see if I see any little symbolic hands waving or real hands waving. All right, Jason waves.
I have one thought, yeah, and we actually used to do this quite a bit in the past, and maybe there's just not a need so much, but maybe, you know, with our dial-a-ride or on-demand response, having that connection between the 2 counties. We used to connect with Kitsap almost weekly with one rider, and it just worked out great. You know, we'd see the fax come through with access, and able to get her, you know, back and forth through the week. It was a great service, and I'm just not sure if it's not needed at this time, or you know, if the demand's there, but we're not you know, doing the extra footwork, because there was a little bit extra involved to get that going. But I would like to see more of that happening. I think that would open the door for those people that don't want to take the route or can't take the route, especially, you know, in the COVID climate.
Right, great, thanks. Okay, looks like Wendy, I think.
Sorry for my poor health. I'm having trouble arranging my words. But I wanted to bring up along the lines you said, well, what else do people need to be traveling to? And we've talked about coordination, and it's been great listening to Linda talk about a dosage clinic. I was thinking that dialysis is one of those premier medical services that requires the utmost coordination. And sometimes even I've met dialysis patients that are low impaired vision. So seeing them, you know, perhaps sitting at a bus shelter waiting for their connection, they look so vulnerable in my mind, I have to admit. So we're seeing some new dialysis facilities show up in Port Angeles. I wonder if we're seeing some other dialysis facilities because of the increased need, and whether we should be focused on this emergent need, and also include that in our transportation plan.
Great. All right, let's see. Oh, Patty put in chat if anybody has a number with the VA to assist veterans in Mason County, she would appreciate. Or let's see. And Ed put in a link, so I guess we can get a link there. Maybe that's a contact.
Thank you.
All right, anyone else? Specific services or maybe enhance things?
Well, AT, this is
Ed, yes.
maybe a little different, but one of the issues we have in just public transit, but also all the other non-traditional transportation services, is that many of the social services that people need to get to are often located away from areas that have strong transit service. That includes the ADA services such as access, paratransit, that kind of thing. And perhaps we have something in the plan that acknowledges this issue. There's a lot of reasons, you know, maybe a Social Security building lease might be away from a transit line, you know, because of the rent cost or availability, et cetera. But this is, you know, a big problem across the nation. And I don't think, you know, we actually probably do a pretty good job in the region, but there are some areas where it's difficult.
Ed, are you thinking almost like I don't want to say a policy, but a suggestion and encouragement that on the land use side of things, when, or, you know, when organizations are thinking about building location or sites, you know, siting, that we encourage them to think about access for their clients?
Absolutely.
When deciding where to put the building?
Yeah.
Yeah. Yeah, you wouldn't believe how many places I have been where that is a major issue. Put all the human services agencies outside the bus service area, and then wonder why people can't get there.
Yeah.
Right, others, or maybe the last one, just in terms of coordination strategies that we ought to be exploring as we work through this plan. Do you have any thoughts on those or heard of things? And you know, we've seen a lot of things at work. We know some that sound great and are real challenges to implement, but we'll be looking to put identify ones that will fit with the needs we hear as we go through the process. But I want to give people an opportunity to, if you've thought of something or think we ought to be looking at some things, let us know now, and we'll get that opportunity at our next meeting to discuss those a little more as we bring ideas to you and hear back from you. But up front, just if there are things you think we ought to be looking at.
Can I throw one more at you?
Sure. Or a couple if you want.
This is more in support of the transportation, but we have some vulnerable passengers that, you know, to get to them in our dial-a-ride, they have trees that need to be trimmed or potholes. We can't really access their residence. In the past, we've been able to get like Catholic Community Services or, you know, local companies to help out, to get us that access. But since COVID, they've all kind of reeled that back. And so that's just something that we think about, as well as getting those vulnerable passengers. We have a lot of dialysis patients that we're not able to get to there, even in our smallest vehicle, because of these certain aspects. So maybe that's something we can think about as well. I don't know if there's resources that we could use that, or have in combination to help with that.
That's
Hey.
an interesting accessibility measure. You know, if you think that, yeah, you can't actually get the vehicles into where the people live.
Right. Curb to curb or door to door don't work if you can't get anywhere close.
And asking that 90-year-old dialysis patient to walk 100 yards to the road is, you know, that's not something I want to do.
Right. Yeah, exactly. Right.
I'm kind of curious. We talked a little earlier about coordination. One of you was talking about coordination between like the transit agency and Jamestown S'Klallam tribe. I'm curious how easy that coordination is, say, between tribes and transit, tribes transit, nonprofit, tribes transit, nonprofit, NEMT. How do you all feel like you have the right tools and the right contacts and the right, you know what you need to do to do that kind of coordination between agencies? Is that fairly easy for everybody, or is that something where this plan could say something to help support improvements there? And Athena, and you had your hand up. So you don't have to tie into that.
Well, I could tie into that too. Yeah, I think that there could be help with coordination. I know we have some ideas of how we would like to expand what we offer to include some a van that would go out to Nia Bay or La Push to help that population get to where they need to go. And so we're in the process of trying to evaluate how can we add that to what we're doing. So yeah, having some coordination with that. Originally I had my hand up for, oh no, did I forget it? Oh, the last, what coordination strategies should be explored. It would be great if there was like one spot where everyone can go to find out all available transportation opportunities that might be available for them and map it out to, hey, if I need to go to Tacoma, you know, if I need to go over here, whether it be a phone app or a website, because coming here, I've learned about new transportation opportunities already. And yeah, it'd just be great to have one place where somebody could go to.
Yeah. Great. Okay. Yeah, that is often a key issue. People don't even know where to start sometimes. And you get the myriad possibilities, and where do you even begin to look to get a ride? So good.
And
Any others?
That does
Yes.
bring up the senior population who is not savvy with cell phones, because like Google Maps will do that for you. It will tell you all the transportation, but that is dependent upon if the transit companies are keeping up with their routes. It has to be good information or it's not valuable.
Yeah, and actually a lot of the specialized transportation where they're focused on specific clients aren't even in the Google system. So.
Yeah, in some parts of the country, there's oh, sorry, go ahead. Somebody who's had their hand up before me. Sorry, Wendy.
No, I think Miranda's had her hand up the longest, but.
I just wanted to address Sarah's question about you know, how our demand response systems coordinate. They do, but it's clunky because we all have our own processes and procedures of how we build our manifests for developing the schedules for these demand response services. So, you know, the tribes may have one system or software that they use to develop that. Clallam Transit has another software. And then Jefferson and Kitsap, we have, you know, and then there's certain policies that we put around how we operate our own services. So it's there, it's just going to be clunky until we, you know, and when I say that, I mean, we may drop someone off at Jamestown at maybe like 12 o'clock because they're trying to get to Sequim, but maybe Clallam doesn't come through there until 12:30, 12:45. So their dial-a-ride service window wouldn't start until 12:30. So that person is going to be sitting out there for half an hour. And, you know, a big part of the dial-a-ride is it's for individuals with disabilities or health conditions that prevent them from riding fixed route. So they're already, you know, they may already have challenges, and, you know, maybe weather is one of them. And if they're in an area where it's, you know, if they have to make this trip on a snow day, it's not going to be good for them, you know. So those windows can create barriers for one. But I think, you know, we do make the effort to say, what is this agency doing? You know, I think it's a little bit more coordinated with our fixed route service, because it really is a point-to-point schedule, right? It's not as dynamic as demand response would be throughout the day. So, you know, we can say, where is Kitsap at this time of the day? You know, when's their bus coming through? Can we line up our bus to meet with them without breaking these other connections? How best do we do that? And then we may say, hey, are you guys changing your schedule? Or, you know, we're ready to print a schedule, but are you guys making changes? We want to make sure before we make our changes that we're not disrupting anything that they may be planning, right? It's just more difficult with demand response because the schedules are dynamic from day to day. So I think that, you know, that it may be a bigger conversation about how do we coordinate these services a little bit more, but yeah.
Yeah, even where your paratransit service areas overlap, you may have a ride out in one of those, and the other agency may not have anything close for that day, other than your transfer. So it's very challenging. So let's see, I think Wendy was next up. Is that right?
Sure. I wanted to mention 2 items. Thanks to Miranda tipping me off. There was something else to be said. She mentioned Jamestown Slalom's location, which is well served with restroom facilities, as well as a large shelter. But also there could be a reason that it's a very blustery, very exposed to the elements, and we're going to be developing a transit grant to be able to improve some of that and make it more improve the lighting out there is going to help customers to be less vulnerable. But I also want to mention that we've not been very successful with dealing with the snow on the ground. We've had so many days that Jefferson Transit and Clement Transit has had to shut down service to this main area. And I think that is indicative of working in coordination from multiple agencies, whether it's WashDOT and their big snow plows, the county, and then tertiary. Clement Transit has snowplow attachments for their pickup trucks. Somehow we need to identify and prioritize these locations where the vulnerable population could be needing desperately to get back on a Jefferson Transit vehicle or Clement Transit vehicle and get on their way. But having these locations change or not even be served I think is detrimental to some of the priority rights that we serve. And then the second issue, switching gears, I am not surprised anymore when I'm on a bus at my commute morning time and there's this sweet elderly person who gets down to swim bay and they say, "Where am I?" And it's because they've gotten on the wrong bus. They recognize the branding of whether they're on a Clement Transit or a Jefferson Transit bus, but they don't know which bus they're on. And I wonder if there's a branding issue that is something that can be spoken to in the plan for all the different options we have to serve the same customer. whether it's branding inside of the vehicle or on outside of the vehicle. It may be insignificant cost, but I think it would go a long ways to help that embarrassment of saying, oh, enjoy the ride, or at least you're warm inside the bus. Oh, you'll be late to your appointment, but here, let us help you make the phone call. Whatever, you know, that has to transpire as a result of a simple mistake. That's it for me.
All right. Thanks. Yep. All right. Ed, are we back to you now?
Oh, yeah, my question was answered. Thank you.
Oh, okay. Great. So I just should point out for anyone interested, Elizabeth put in the chat that WashDOT has planning grant funding available. So if you haven't looked, you might want to look at that, and you can contact her. So they have, in addition to the consolidated grant program, they have ad hoc planning grant funding available. So if you want to pursue some additional planning funding, that is an option. Then Dina put in that improvement probably is needed for Sunday services and entry-level jobs. That's when you work is the weekend and bad shifts. Probably a need in that area. All right, anyone else? Yes, there.
Oh, yep. Me, one more time. I got to ask you guys, when I think about the services that you provide, I think a lot of your clients really could not take public transit at all. But I also think some of your clients might be able to take public transit, except that it's not available because of where they live. And I'm wondering if you ever do the kind of coordination where some of you are providing sort of first mile, last mile service, getting people maybe from a remote rural residence into the transit system where then they can jump on transit and they're good, or when they get to the end, getting them from where they got off to wherever they're headed to. Is that part of the coordination that you all do? Or are you all pretty much like Nancy, when you pick up somebody, you're taking them all the way to the end and waiting for them and bringing them all the way back? Is there any of that kind of, I'm going to call it multimodal, or, you know, just getting people into the system who can use it? Is that something for you all, or not really?
I'll speak for Mason Transit. That you just described our business model. You know, we have got a lot of outlying people. Let's bring them in, usually to our main transit center, and then from there they can get, you know, to Kitsap, to Olympia, around town for their grocery shopping, and then back on the dial ride to get home. So that's, yeah, absolutely. It helps with our ridership as well. We could double dip there. But yeah, that's exactly what we try to do.
Okay, anyone else want to respond to Thera's question there?
Thanks.
I'll just mimic Jason. The point of dial ride is to bridge that gap for using fixed route. For people who have, you know, they're prevented because of a health condition or disability, either to do the first last mile, or, you know, there's a couple categories that don't, like, I would hope that most transit agencies nowadays would have accessible vehicles. You know, I know that there's some small agencies that are still trying to get all of their vehicles equipped. Like our van pools aren't, but we haven't had a request to do that. If that were to come up, I feel like we would find a way. But I think that, you know, most of the eligibility is going to be because of first last mile issues, or even some cognitive or vision impairments. And especially in a rural area, that becomes a bigger barrier. You know, when you have in an urban environment, you know, Jefferson County Council of the Blind has, they've been talking about trainers to come in and help people with newly developed vision issues navigate. It's not easy in a rural community because things aren't consistent as you're traveling down the sidewalk, right? Or if there is a sidewalk. So when you're in an urban environment, those things are, you know, they're more prevalent. And then when you get to the rural area, that starts to get, you know, so I think that in our case, that's probably one of the bigger eligibility conditions when it comes to paratransit. But it's also conditional. So they may not be all like where they can't ride it all the time. Maybe they just can't get to a bus stop, right? So then that's where we come in and bridge that gap. So, you know, it's not supposed to be an entirely separate service. It's supposed to be integrated. So we try and bridge those, you know, like the connections with Kitsap. If we can get them on a fixed route to get over there, we will.
So Miranda, do you do conditional eligibility then?
You know,
For your paratransit, or is that in theory but not in practice?
In theory, but not in practice. So we
Okay,
use it to say,
yeah.
hey, this person is eligible under these conditions, but we don't say, hey, you can't ride our dial-a-ride because, you know, we don't enforce the conditional eligibility per trip. So we just use it to determine, hey, are you eligible? Under what circumstances would you be eligible?
Okay, and then kind of rely on them to make the decision themselves.
Yeah, we definitely do.
Right.
We don't audit trips. We don't go, oh, well, you can't ride this time, but you can ride in this circumstance.
Okay.
We just book them, so.
Right. All right, anyone else? We're kind of coming to the end of our scheduled time here, but want to make sure anybody else have other comments to add or anything before we wrap up. And let me say, if you know, tomorrow you think of something that you wish you'd have said today, please send it in. We've got the contact information. This has been a great discussion. I think helps us understand things and get a better picture. And as we start getting the information, we send out the questionnaire that will help us as well. But what I want to do is just put up one last slide, and I'll share that. Let's see where here we just kind of next steps. So we will be getting out the 2 survey questionnaires. Again, very soon we'll be putting together that first interim report in the latter part of May. Plan on our next meeting in late June, but ask you to help with getting the community survey out, publicizing that, distributing it. Let us know if you need us to help you in other ways, and we'll figure out how we can do that. I mean, either contact Sarah or Rebecca or me directly, and we can do that. And then when you get the provider survey, please provide that information, because that will be very useful for us to be able to put together that inventory of existing resources. And last, just to put up contact information that for Rebecca and for me, both email and phone, and those are actually our direct phone lines. They don't ring to the office, but ring directly to us, so you can get hold of us. And so feel free to do that, or contact Sarah. She can get hold of us. She knows how to as well. I certainly appreciate all the discussion we had. This has been, again, very helpful. And I look forward. It's a little while before our next meeting, but we'll be in contact, and look forward to having the discussion at our next meeting in June, and we'll let you know when that is. Darryl will set that up again and have the discussion on, okay, here's the picture, here are needs, how do we address those, and what options do we move forward with? So I don't know if there are any other final comments from you.
I just really want to thank all of you for taking the time. If there's we're going to be following, there's a larger group that we're communicating with, but you know, obviously people have busy schedules and they can't all attend. And so we'll be circling back with them. But if there's anybody that you think we should be including in this discussion who's not, you know, and you're not sure if we've got them in our loop, if you would send that information, that would be really helpful. This is that kind of networking that expands, you know, expands our contact list. And we'll send out to you a link to the video when it's posted, as well as some of the resources. Like I said, as AT read, Elizabeth and her contact information about some other planning grants that might be useful to you in scoping out some other options maybe ahead of the consolidated grants or separate from that. So we'll send that out, make sure everybody has that. And thank you very much.
Great. Great.
I have a question.
Thank you. Yes. Yeah, I was going to say, anybody have final questions before we close up? Yes,
there
go
are
ahead,
a lot
please.
of people on this list that I would like to be able to contact at different times. Is that list available somewhere, or just go back to this video?
We will, when I send this out to everybody, all of you will be on here, as well as the others who could not attend today.
Okay.
And as we go forward, this is one of those things I'm keeping my ears open for. As we go forward, if there's value in establishing some sort of a communication group among these entities, we'd be really happy to put that together and put that out there if that would have a value to you all. So I won't say we'll jump in and do that right now, but I am open to that if that is something that would provide benefit to everybody.
Great. Anyone else? Final question, or I don't want to keep you any longer. I know everyone has a lot of other things to take care of, and particularly if you're trying to run transportation services. So again, thank you all, and look forward to being in touch and getting your information and talking to everyone again in June.
Thanks, you guys.
Right. Bye.
Bye.